All right, we are live. Hello, everyone.
Hello.
Everyone's having a wonderful start to your Monday. So today we're talking about a topic. It is drug-induced nutrient depletion. Now, this is a topic that most people have not a clue about. And not to mention that, but also when your physician prescribes you these medications, they don't tell you what can happen to the nutrients in your body. Maybe if you have a really good pharmacist at the counter where you pick up your medications, they might enlighten you on what you need to take, because what can happen with these drugs that you're on. So this is not my wheelhouse. This is all Ryan. So I'm going to hand it over to him, and I'll jump in anytime I think things might get a little bit too technical or scientific, and I'll try to help us dumb it down a little bit.
Thanks, Lisa. And I'll try to keep it simple, but this is a passionate topic for me. So I tend to go ramble off into different rabbit holes on this topic. So from my perspective as a pharmacist, I started as a community pharmacist working the bench and seeing people come in. Really all it was filling prescription medication orders from a physician. And let me tell you, I'm not here today to bash the big pharma or the prescription industry. That's not this message. Actually, this message is more about an awareness. I want to bring awareness to this topic. It seems to not have really received much traction at all. And I'm not sure why, because maybe it's the mainstream physician side where they're just not paying attention to it, but they really should be, because in the pharmaceutical industry, when they get a drug product brought to market, as you see, there's a lot of clinical trials and studies and documentation. There's package inserts. It's well documented that drug-induced nutrient depletion is a very real thing. What that just basically means is that prescription drugs can cause your bodies to be depleted of essential vitamins, minerals, essential fatty acids. So that's what we're going to talk a little bit about today. So it's a complex topic. I was not really all that sure how I wanted to break it down. I was thinking, well, I could do it by disease state. I could do it by mineral that is, that's depleted. And then I could go, of course, off of certain prescription drugs. So I'm going to kind of go by disease state. But to be honest with you, I would say almost every single class of medication depletes some vitamin and mineral. I mean, we're seeing it in antihypertensive, so blood pressure meds. We're seeing it in anti-diabetic meds, so all the blood sugar lowering medications. We're seeing it in antidepressants, antibiotics for sure, which, by the way, this is a multi-part series. And I know, Lisa, you'll love this, but one of the parts we're going to cover is drug-induced microbiome disruption.
Yeah.
That'll be a big one. But of course, antibiotics do a little bit of both. They deplete minerals, vitamins, and stuff, and they also deplete our microbiome and our gut functioning and communication and all that stuff. So there's virtually everything. All these prescription drugs. When you start going down the hall and you're looking at the resources and you're looking at the minerals that are depleted, you're like, wow, how is this a thing? And I'll tell you from my experience. So I'm on the bench. You come in for a prescription med. You are filling a water pill, a diuretic, okay? And I've seen this case a lot. You're filling a diuretic. Say it's hydrochlorothiazide because you're just recently diagnosed with blood pressure and it's one of the first line meds they use. And I don't let you walk out the door. I'm like, hey, look, I need you to know what this drug is, what to expect from it, how long you expect to be on it. And I tell these people, I said, you can expect maybe to feel some anxiety, maybe to have some headaches, maybe some muscle spasms. And I let them know. I said, this is important, and you really should supplement with magnesium. So, weeks go by, and this same patient will come back in the door, and lo and behold, they have a prescription for an antidepressant or anxiety medication. And I'm looking at it going, hold on a second. Before we fill this medication, do you recall the conversation we had? And then I walk it back a little bit and say, well, let me tell you this about from this angle. Magnesium depletion also shows signs of muscle spasms, anxiety, and headaches. Yeah, you see what I did there? And the patient kind of goes, okay, let's not fill this prescription yet. What magnesium do you recommend? And then we would go that route. But I feel like I'm one of the minority. I'm the minority in that world.
Oh, for sure. And think about how many times you've gone to the pharmacy and they haven't done that. I mean, that's like where Ryan's passion lies.
Sure,
so
yeah.
He loves to help educate and let people understand what's going on, not just able to do the job by filling a prescription and passing it on.
Yeah, and I hate it. Nowadays, it's a volume game. These pharmacies are stressed out. The pharmacists are being inundated with other nonsense. I mean, it's called drug utilization review. Before any drug is dispensed, they evaluate you and your drug history to make sure there's no interactions, drug contraindications, anything like that. But yet they're leaving this really important part out. And I know pharmacists don't mean to, but it's very rare to hear somebody speak to that level. And we really need to be doing a better job. And look, it's because of we want to improve patient outcomes. It's not because I don't want them to get help with the medication. It's like, no, hold up. It could be a side effect. So the point of that story was so often, and this is polypharmacy. This is the way it is in our country, in the United States of America. I mean, most people are on some prescription medication that can cause a side effect, right? Like anxiety. Next thing you know, they're going back to the doctor. Now they're prescribed another medication. So then they're coming back, and so that becomes polypharmacy. And it's a wicked, wicked cycle. It's very hard to break out of. It's education. And by that point, it's over time. These nutrients become depleted over time. So they do become much harder to figure out and to navigate. And it can take some time and some effort to get you out of that nasty cycle. So
you're also saying that typically when you're on a prescription, you're not just on one. So this nutrient depletion encompasses all of this line up here.
Oh my gosh, yeah. And just one, so one med we'll talk about today it knocks out 5 or 6 important essential nutrients.
All right.
So yeah, I mean, ultimately that's the name of the game, is to try to help people prevent, like, look, and spend. We don't want people to spend so much money on prescription meds. No, we don't want people to rely on prescription meds for a side effect of another medication. That seems ridiculous, right? So that's nuts. I think I covered everything. So we said, and benzodiazepines are another class of meds. So for people on anxiety meds like Xanax, thyroid's a class, HRT and birth control. Another really big class of meds that knock out some important essential vitamins and minerals. Acid reflux, holy crap, that's the one where you're taking PPIs or a histamine blocker for stomach acid because you're getting reflux. Wow, you're changing the pH of the stomach. You're really jacking up some nutrients there.
Sure. And a lot of times stomach acid reflux is due to low stomach acid.
Right.
It doesn't really make sense, but so you're treated as if you have high stomach acid, but really you have low and you're getting acid reflux and you're treated for high.
Yeah, absolutely.
Yeah.
And then of course and these will all be the multi-part series. We'll cover these at some level, but NSAIDs, the anti-inflammatories like naproxen and Advil, and also the opiates. A lot of people use opiates, so there's a lot of drug interactions and drug nutrient depletion there as well. So the way I thought we would go about this is looking at it from sort of a big picture, and we're going to talk about cardiovascular disease. That's the #1 killer. It's the most common. Over 100 million Americans have some level of high blood pressure. And in this category, I did throw in statin drugs that are typically used for cholesterol, but they're really used for inflammation, reducing cardiovascular events.
Right.
So I threw statins in here because I wanted to get a little extra into this video so that because there's so much to cover. So
right. And this is not to say stop your medications that you're put on. This is to make you aware that these medications that maybe your body needs right now are just causing nutrient depletion. That if you need to make sure you're supplementing with the essential nutrients, guys, which we have right here with our daily essentials pack, and then the factor 4. Supplementing with these to prevent those nutrient depletions, to prevent maybe another prescription that you think you need or your doctor thinks you need based on a side effect of the one.
And I don't just blame pharmaceutical. I agree with Lisa. And I'm also a proponent of making sure blood pressure is controlled. And if lifestyle is not doing it, which for most people it's not. That's the reason why we're in this issue, right? We're eating junk food. We're relying on a sad American diet, standard American diet, highly processed foods. They're calorie rich, they're nutrient poor. I mean, so we're in a really bad state of health right now. And so medications to help get our blood pressure under control are indicated. Same with statin drugs. I'm not going to put my opinion exactly on statin drugs, but yeah, I mean, ultimately we do see the evidence supporting the use of statin drugs in certain classes of people, but I think there's 50+ million Americans on a statin drug. That sounds outrageous to me, especially when you consider all the different side effects and nutrients that are depleted by that class of meds. So that's the way I want to approach it a little bit today. So I was saying, okay, so let's go into the blood pressure thing. So again, that example of a water pill, right? You go in, it's one of your first line medications when you have high blood pressure. So, and 100 million Americans have, right? So you have now you just, and it says it clear as day what the water pill does, what hydrochlorothiazide does, or chlorthalidone does, or furosemide. That's Lasix. That's a different class, but it's still considered a diuretic. What they do, they prevent the reabsorption of sodium, potassium, chloride, and they excrete massive amounts of magnesium. Hypomagnesemia. It's a very well-known, documented clinical findings, and just nobody seems to pay attention to it. So again, go back to that example. The person that gets on a water pill is not told that. Now they feel like crap. They are not feeling themselves. They feel out of whack. They're back. They get another medication, and so on and so forth. But the drug, it's not just magnesium. We're knocking out potassium. We know sodium goes. We know chloride goes, and in some examples, calcium also goes. So coenzyme Q10 is another one that you see go. So
That's
from
statins, right?
yeah, that's also in the diuretic class.
Okay.
Also in the diuretic class, and we'll talk about that for the statins. But so okay, dietary supplements, how effective? A highly effective ultra magnesium complex. When we talk about the statin drugs, you're going to hear me talk about the D. We just said coenzyme Q10, which is our factor 4. Here's your multivitamin with your Bs, your water solubles. I mean, so you're running, and all of your other essential micros. And so I'm looking at this, and I just feel like so many of our problems are based right in that issue alone. So the use of dietary supplements, more and more physicians are coming around now. There is way more literature to support the use of dietary supplements. Remember, guys, you need to pick a high quality supplement for sure, because like Lisa will always tell you, it's just as important what's in it as also what is not in it. So and then zinc, selenium, there's other it's like there's a bunch of things. So, and of course the zinc, we have zinc in our multivitamin as well, which is a really important antioxidant. It has a lot of functions. But think about the example of magnesium again, involved in over 300 biochemical reactions. Thousands of reactions, essential vitamins and minerals are a part of. And when you interrupt, so let's go back to the blood pressure example again. You use a diuretic, that's a water pill. Let's get rid of the sodium. Water will follow, osmosis follows, right? You drink, you're getting rid of fluids. Great, okay. Body reacts. There's compensatory mechanisms. But what you're doing is you're interrupting some aspect of the cascade of events that is considered homeostasis. That's the body's normal state of health, right? Health and balance. So when that gets disrupted, there's a compensatory mechanism by the body. So now the body goes, oh crap, well, maybe we should add another medicine. Blood pressure, it went down for 4, 5, 6 weeks, but then it kind of crept back up. So let's go to another we're going to try another medication. Then they put you on an ACE inhibitor, right? So you're going to see lisinopril is probably the most common ACE inhibitor, and same issues. So it's like you have similar issues that you have to be aware of these micronutrient deficiencies. And I'm not saying that that's not appropriate therapy to be on a water pill and an ACE inhibitor. That actually is probably very appropriate. But just guys, please be informed and educated on which vitamins and minerals you are depleting your body of.
How would one know this? So your doctor puts you on a medication.
Sure.
Without you sitting here and telling each one, because like say someone emails you and says, hey, Dr. Ryan, I'm on this medication.
Yep.
What should I take, avoid? I mean,
yeah. And since I'm not involved in your patient care, I can't give you specific health recommendations, but I can give you broad stroke. I mean, most physicians will order another blood panel, look at your Chem 7 or Chem 8, and they'll see sodium and chloride, but then they kind of stop there. They don't pay attention to magnesium. It's not an easy one to test anyway. Most of your magnesium's in your bone, muscles, and tissues. I'm just drilling on that one right now. But yeah, I mean, I agree. You should want to know, like from your physician, is there a way to measure, to monitor my progress and checking in on micronutrient status? And
not a bad idea too, when you pick up your prescription, ask your pharmacist.
Please.
Now that you know about nutrient, if you didn't know about nutrient depletion, now that you do know about it, say, okay, hey doc, or hey pharmacist,
sure.
now that I'm on this prescription, what other supplements, vitamins, minerals should I be supplementing with that this medication will start to deplete? So ask these questions. They have the knowledge. Just as Ryan has the knowledge. They have the knowledge. You just have to ask.
Yeah, it's right there in front of them for sure. They've been told it many, many, many times. All right, Lisa, you want to see if there's any questions on the board here?
Okay.
How are we doing on time? Pretty good.
Drug-induced nutrient depletion. So basically just taking the drug depletes your a nutrient or nutrients. You're frozen. Hope we're still not frozen. Okay. If I have any additional.
I mean, things like anxiety, chronic stress also further deplete the body. So we talked about lifestyle. Lisa will often talk about the food sources just don't have the nutritional density that they should or once had. But like things like magnesium is further depleted, and B12 further depleted by chronic stress and anxiety. Exercise, different like lifestyle things will knock out magnesium. So I don't understand this culture where we're not why we don't recommend magnesium and essential minerals and vitamins more often.
Do you take these in unison with what the products are already taking? So yeah, I'm assuming that means if you are taking a prescription drug, yes, you take the vitamins and minerals at the same time. Yes, you are trying to prevent the depletion that the further causing.
I'll give you best practice, I'll give you best practices on certain things, like when to take things. We'll talk about with antibiotics and probiotics and different things of that nature. But for now, there's really no, I mean, well, there's certain timing on some things, but really nothing specific related for this. So blood pressure, big category. We could spend a lot more time here. We could go through each and every single drug, but the message is just please be educated on the medicine you're taking. You want to send me an email, I'm happy to respond. Remember, I'm going to give you a broad stroke. I can't tell you specifically what to do, but based on your med, I can tell you what's likely a depleted mineral or vitamin.
Perfect.
Yeah.
And that's what I think that's what I think this is really about.
That's what this is about.
That's what we want you all to understand. So ask away.
And what it's about, I'm going to say it again. It's about people feeling better and avoiding unnecessary additional prescriptions. I can't tell you how many times I've seen a prescription come in that, in my professional opinion, was treating a side effect of another med.
Right.
It's mind-boggling. Look at the numbers of polypharmacy. Like the average number of people are taking 3 or more medications.
And what about like B vitamin depletion? I know that's a big one. And a lot of times, when we're depleted in B vitamins, we're tired, and you just wonder what. Yeah, and you wonder what that is, and then you start to. Maybe you go to the doctor. I'm tired all the time. What's going on? Maybe you just start excess caffeine. Who knows what you do? But this could just be simply that because of the prescriptions you're taking, your B vitamins are depleted, and we have the full B vitamin complex in our multivitamins. So like these are where we always say our daily essentials and factor 4. Like these are what everybody needs to take every single day, whether you're on prescription medications or not. We always want to prevent these nutrient depletions, because on top of drug-induced nutrient depletion, there are other things in our life that I've talked about before, you've heard it, that further deplete our nutrients. So this is just one big topic.
Yes. So I did say I'd throw statins in. I kind of regret the fact that I did that, because statins being such a large topic, I consider 50 million Americans use a statin. Professional opinion aside, I mean, they work, they do their job, but listen to people when they tell you the most common side effect is a myalgia, muscle ache, muscle pain. And you listen to it, and then you look at the mechanism of action. How does the drug work? Well, it's an HMG-CoA reductase inhibitor. What's that? Coenzyme. And then you hear all these reports of depleting coenzyme Q10. So I'm not saying that there's conclusive evidence that statins deplete CoQ10, but one study showed 54% of people on a statin had a reduction in CoQ10 levels. Okay, that's pretty significant. But then on the other hand, patients that were suffering from myalgia and low CoQ10 levels that took CoQ10 did not have an improvement in one study. So while it's not fully conclusive, coenzyme Q10 is incredibly important in so many ways and so many aspects of our biology. To me, I wouldn't even want to take the risk. And there's enough evidence empirically. Now, I would just empirically say, yeah, I should be taking coenzyme Q10 for sure. And I would recommend that to people in the pharmacy setting. And whether or not, but they most often, the vast majority will come back and say, thank you. I think this is helping a lot. So, because myalgias, there's dull, aching, muscle aches, pains, cramps. I mean, that's a common side effect of statin drugs. So we wanted to address the coenzyme Q10 topic, and you'll find that in factor 4. And then also some fat soluble vitamins, vitamin E and vitamin D. So as you know, the lipid lowering drugs, the statin class of drugs are lowering your cholesterol. Well, cholesterol plays an important part in cellular health. It's also a big factor in our vitamin D synthesis in the sun. So now you're seeing, right? You're seeing statin patients with depleted levels of vitamin D. Now we're already low. Most people are already low. The food sources of vitamin D suck. So, okay, like guys, there's enough now. Vitamin D, like absolutely essential vitamin D. Need to be taking vitamin D with K2. 2,000 units, at least 2,000 units a day. Monitor your levels, get your levels checked. That is one that's easy to check and very cheap. So please have your physician order that number. But if you're on a statin, now we've got CoQ10 knocked out, we've got vitamin E knocked out, we've got vitamin D knocked out, and so also zinc. And so now we're like, you're at my counter, you're picking up your water pill, you're picking up your statin, and you just caught an earful for 15 minutes. But it's not because I'm simply just trying to educate and make sure that you guys are well informed. So that's the importance of kind of those two classes of meds. So, omega-3 fatty acids, as well.
Also,
Shocking, yes. Within a statin class too, omega-3 fatty acids, that is your fish oil. That's your fish oil. So if you're on a statin drug, of course, most people know fish oil is good for cholesterol. It can raise the HDL, it can lower triglycerides. And so, but because the statin drugs can also affect your essential fatty acids, I strongly suggest you stay with your provider or you start on factor 4 because it has omega-3 fatty acids.
right.
Yeah.
And I don't know if this is you personally, but I've heard it many times in my practice, as well as I'm sure you've heard it yourself. A lot of people say that if they're on a medication, so say you're on something for high cholesterol, therefore I don't have high cholesterol, but you do, you're just medicated to keep it down. But you think, I don't have high cholesterol, therefore I don't need to take anything that helps lower my cholesterol. But then you think about it, great, it's down because of medication. And if you choose to want to stay on that medication, it works for you, that's great. But then you also have to understand, again, the nutrient depletion that's happening. So regardless of it, you've got to be supplementing with it. I mean, this lineup is powerful.
Yeah, no, it really is. And this is your daily essentials pack. I mean, obviously we talked about adding this in, so you'll see that here soon. But that daily essentials pack, guys. So that's it for us today. How do we do on time?
Good, great stuff. So again, a lot of these questions, I always say, obviously email me, because I'm able to get to the emails better than Ryan is. If there's something specific, like about medications, you can still send them to me and I will always go to him and ask, or I'll forward it to him, or we'll discuss it together and I'll get back to you.
Awesome. So like I said, multi-part series, guys. So please stay tuned for a lot more on this topic. Let me know. Send us an email, comments, questions, and we'll get back to you as soon as possible.
And apologize for all the doors banging, but
kids home for summer break. That's the way it goes. All right, y'all. Have a wonderful, productive Monday. Bye.